Hello, my name is Carlos Robles-Medranda and I am the head of the Endoscopy division at the Ecuadorian Institute of Digestive Disease. The title of our article is Reliability and Accuracy of a Novel Classification System Using Peroral Cholangioscopy for Bile Duct Lesions Diagnosis. Biliary lesion diagnosis is challenging and sometimes ERCP offers image limitations. Moreover, when an indeterminate biliary structure is seen, a certain diagnosis by ERCP depends on a blind biopsy, which involves the risk of missed pathology and sample mistake. Differentiating neoplastic from non-neoplastic lesions is imperative because management differs greatly. Macroscopic features of neoplastic lesions has been described previously in cholangioscopy, however with a poor inter-observer agreement. Despite the direct visualization offered by cholangioscopy, many misdiagnoses are made due to the lack of correlations between macroscopic aspects of biliary lesions and histology. Thus, a standardized classification using cholangioscopy is necessary. Our results demonstrate that by using this new classification, the visual impression could be improved with an increase in sensitivity and negative predictive value of 96%. Furthermore, the proposed classification was validated with an excellent inter- and intra-observer agreement for expert endoscopists and good for non-expert operators. This high concordance rate is important if we expect a widespread use of the classification in the daily practice. We encourage endoscopists worldwide to use the proposed classification in their clinical practice. Also, multicentric prospective studies are necessary to validate our results. We want to say thank you to the editorial team of Endoscopy for accepting this study for publication. We hope that this novel classification system could help physicians from around the world to differentiate neoplastic from non-neoplastic biliary lesions during cholangioscopy.